here when I get a little closer to the router. I'm off site in a place with sketchy internet.
Not a problem.
So thank you all for all that you're doing. You guys are incredible. This obviously is not where we wanted to be in the summer, and things are, growing increasingly serious. Let me start off with some good news. Just gonna get the thing to work here. Can y'all see me? So here's a little good news for us. We were able to negotiate yesterday an additional 1,800 two-day turnaround test with Hanu, our vendor. You have the federal tests that are taking 8 to 10 days, and it's just a mess. And then you have the Hanu test, which are taking 1 to 2 days. So if you have somebody that gets one of these federal tests, I'd strongly recommend, if any of your employees have insurance, you don't go to the free test sites at this point, unless you go to the one in Irving, okay? But don't go to the other ones, okay? Because what they're gonna have to do at this point is pretend like they're sick, whether they are or not, and isolate till they get their test back. That's what you should do anyway. If you have symptoms and you think you have COVID and your doctor says, or maybe you don't have a doctor or whatever, either they've ruled out other things or you don't have a doctor, so you got to get a free test, then you should isolate until your test comes back. If you go to the site in Irving, you'll get that back in 2 days. But if you go to the site in South Dallas or one of the walk-ups, you'll get it back in 8 to 10 days. So that means you'll be isolated at home, potentially without a paycheck for 8 to 10 days. So that's a little tip there. We are going to get these extra 1,800 tests from Hanu. After my call with you, I'm going to be talking to Dallas County Community College District and put those in a couple of college campuses, I hope. One that's close to Grand Prairie and serves Grand Prairie, Duncanville, Cedar Hill, and the Mountain View area. And the other one, I think it's Eastfield, I can't remember. So wherever else Parkland said they needed it. So I got to talk to them about that. If for some reason they can't do that, then they'll all find someplace near those two places. So that's good news. Another piece of good news, I hope it's good news, and I'm sure they're doing a good job on this, but the hospitals are on an accelerated discharge plan now. So they're discharging people faster. I don't know if this is COVID people. I think it's also like hip replacements and everybody else. This we think will help with the bed capacity and stretch it to the end of the month as opposed to 2 weeks from now. Hopefully that will work well. I'm sure people, if they need to be in the hospital, they'll find a way to keep them there. But they just told me that this morning, that this is the new plan to give us another week as we ramp things up for the overflow. Now remember though, with hospitals, just because we're going to hit 100% capacity this month doesn't mean that there won't be beds in the hospital. Most hospitals are built for built for 2 beds in each room, but they only have 1 bed there, right? So when we bring in extra beds, now of course, then we need extra nurses and extra doctors and extra respiratory therapists. Hopefully our military partners and some others can help us with that. We have lost a few nurses and doctors in the last few weeks. Not lost like dead, but lost because they're isolated or sick right now. So we're a little low there, and everybody's doing double shifts, and you can't do triple shift. A triple shift would mean you work 24 hours. It's just not possible for this long into a deployment for them to work any more hours than they are. So we're going to have to get some other help there. But that's a bit of good news on the hospital front and the testing front. Mostly the testing stuff is bad news. We're not able to keep up with the tracing. When you have over 1,000 people a day and you have 300 people doing tracing, and even if they manage, which they never do, but if they manage to get to 15 to 20 people that will actually fill out a 45-minute phone survey, it'd be 450 to 600 people a day that they could reach. So you'd always be adding 400 or 500 people to the 400 to 600 people actually to the list of people that is waiting to be reached. We do have a computer program now, so everybody's getting these texts where they can fill out their tracing information. But that is helping with a lot of the young people who will fill it out. We still have a lot of people, we've had thousands of people fill it out completely, but we have a lot of people that haven't. So tracing is falling further and further behind here and in every other urban area in Texas. Testing is terrible. There's no other way to describe it. 8 to 10 days on the turnaround for the federal test, and they will not get us the reagents. We keep harping on that. Hopefully something's going to happen soon. But the reagents that UT Southwestern and Parkland and all the other hospitals have been begging for since May, if we could get those, at this point, we've said to the feds, just give us the raw materials and you can go. We'll do it all for you. We'll do the lab work at UT Southwestern for all the hospitals. And we'll do it in like a 2-day or 3-day turnaround. Hopefully they'll take us up on that. So that's going on. There's a letter that went out to the governor each week, or more than that now. The Public Health Committee meets, talked about that group before. It's the folks chosen by the hospitals that are, by and large, the people over the sections that are actually treating these sick COVID people. They've asked for a few things. Some of those affect business. You can get that off my Twitter, right, at Judge Clay J. But the main ways that it affects business is they want to close all business activities where you cannot wear a mask 100% of the time, okay? It's not that many business activities, unless, of course, you own one of these businesses, right? But it's in-person dining in restaurants, because obviously if I'm eating my food and you're eating your food, we have our mask off to eat our food. And we're seeing spread throughout the United States within restaurant dining. So they want to close that for a time. It's bowling alleys, movie theaters, exercise classes where people can't wear a mask, like a spin class, yoga where they're not wearing a mask and not 6 feet apart, but keeping those where they are wearing a mask and are 6 feet apart. And cigar bars, you can't smoke a cigar and have a mask on. There's a few others as well. Another biggie is because of a concern with the spread that we're now seeing happening in daycare, is restricting daycare back to essential worker families. So that was sent to the governor. That's, again, not my ideas, but their request. I believe a similar letter was sent by every urban area that's experiencing this in Texas, and for that matter throughout the South, to their governors in the places where the opening went poorly. It's the same stuff, right? And it also factors in what the CDC is now telling us to do as well. So that's out there. And with that, I'll take any questions people may have.
Judge, thank you so much. Really appreciate everything you're doing and the tireless hours you and your team are putting in to keep our county as safe as we possibly can be during this time. So again, just a reminder, if you have questions, please utilize the chat function. A couple of questions that were sent in for those that registered prior to the Zoom call beginning. Judge, can you talk about the specifics related to the reopening of offices and businesses as they work to bring their employees back safely? Can a business in Dallas County require its employees to have a negative COVID-19 test before allowing them to come back to work?
No, you can't. Well, if a person has had COVID, we have a rule, and it follows the CDC guidance, we have a rule that if your employees had COVID, you cannot require them to have a negative test in order to come back. What you can do, I suppose, if you want to, is now you'd have to pay for it, but a business could say, you know what, let's all go get tested at, Methodist Hospital, whatever, before we go back into work at our healthcare plan. You could do that, but you cannot require a negative test from a person that's already tested positive. Why is that? Well, there's a variety of reasons, but one is the test will continue to be positive for COVID long after they are no longer contagious and are capable of coming back to work, right? So if I test positive for COVID and I have a relatively mild case and I isolate at home for 14 days and my symptoms have dissipated, I might test positive for COVID for 45 or 60 days, but I'm completely fine to go back to work after 14 days. So that's why we don't allow that. Now, there are businesses that are like, hey, we do this thing where we're all close to each other. We've got whatever it is. The way we work is we're all within 6 feet of each other all the time. So let's all go get a test before we get back together. There's not a rule against that, but you do need to pay for it because we don't have a situation where you can go to a test site and say, we're curious, we're about to start our business back up. We don't have symptoms. We're under 65. We're not, essential business employees, but we'd like a free test. You're not going to be able to get one. So hope that answers that.
Thank you so much, Judge. And then can you talk about really any predictions that you might have on the trend or cases following the recent holiday weekend?
We don't know yet how well the holiday weekend, well or not well, the holiday weekend went. That we know the trend will get worse because no matter what we do, it takes a time for that to kick in and show a benefit. So for instance, if you remember when we did Safer at Home, which was mid-March, we did see a benefit within a couple of weeks of the projected trend not going up as high as what the medical models. But the numbers didn't actually begin to peak out and go down until mid-May. We started going down from that in mid-May. It only went down for about a week because on May 1st, the governor started the reopening process and started with movie theaters and restaurants and things like that, which we all now know is not what we should have started with. And so that number began to move back up, but it took 5 weeks to really see how bad that was going. And the only time we've seen numbers that really show up, good or bad, within 2 weeks are Easter, Passover, and Memorial Day. And obviously both the numbers that showed up were quite bad. So we're hopeful that people did stay home on the 4th of July. What happens on that, just, because people ask me this all the time, what about the Trump rally and the Black Lives Matter protest? Or what about youth sports, which is another thing, by the way, that if your kids are sweating all over each other and bumping into each other, the doctors strongly recommend that the governor close it, which means you shouldn't participate right now until it happens. But what about youth sports, Trump rallies, Black Lives Matters? Well, when we think about how many people participate in Black Lives Matter and Trump rallies, in the whole Metroplex, it's probably less than 10,000 people. When we think about youth sports, that might be 50,000 kids. But when we think about holidays like 4th of July, everybody celebrates somehow, right? There's 7.6 million of us. So if Beth says, hey, I'm going to get together with Clay's family and we're going to shoot off some fireworks and we've all been super careful and blah, blah, blah. And Clay says, yeah, it's a great idea. Let's do it. Well, that's different than what we've been doing, right? And so everybody's doing a little variation of that. I mean, I actually didn't do a variation of that, neither did Beth, but I'm just using that example. That makes a huge impact, see, because that's not, 5,000 people at a rally or 5,000 people at 20 different marches. That's 7.6 million people letting their guard down for just a little bit. And that's why it hurts us so fast.
Thank you, Judge, for those comments and your recommendation to the governor and his team. It's important that we know where you stand and what could be coming down in terms of additional mandates from the state or also the county. Do you have an update in terms of how the application process is going within Dallas County's emergency business assistance program? Are you seeing a lot of businesses apply?
So we have seen a lot apply. I've got an agenda item on for Friday to change that program so that you can get up to $50,000 to add $30 million to that program, and to change the employment requirement from 90% employment, keeping your employees, right, and paying them, to 60%. So in line with what you saw with PPP. Now the way that will work, by the way, if anybody wants to apply, is if you've received 30,000 in PPP, if you've received 30,000 in PPP and you are selected, because it is a lottery, you could receive up to 20,000, the delta between what you've already received and what is left in the program, the maximum. That's how much you could receive. If you haven't received anything, then you could receive all 50,000. Now, of course, you can't receive. It's like PPP. If you can't, if you don't have but one employee and you're paying them $14 an hour, then you're not going to get $50,000. Obviously, you're going to get whatever that is plus your rent. What you can get under the program, and then a little bit of money for yourself, for your own salary, that is. So, but that, that is being added to, and, we're getting in a lot of applications to it.
And Judge, we're hearing on some of the media circuits about our friends within the Austin area, that Austin has a plan to shut down its area for, 30 plus days to, flatten the curve. Do you see or anticipate anything that stringent within the North Texas area that you could be recommending or putting in place within Dallas County specifically?
Well, that's not what the doctors are recommending right now. I made my piece early on that I'm going to listen to what the doctors have to say, right? Because I'm not a doctor and it's a public health emergency. And the doctors, by the way, that we need to listen to are the ones that treat COVID, not our, friend who's in whatever. Sorry for that. But anyway, so no, what they're requesting right now are some changes in the way that we worship, very minimal. I talked to the churches this morning about that. That is, of course, they don't want us to go back and have a big worship service right now. No, to my knowledge, nobody's doing that. When we do go back, they don't want big choirs to sing and blow wind at all of us. They want everybody to be masked, and they don't want people over 65 and with high risk conditions going back in the first wave of people for churches. So there's that. There's the businesses that I talked to you about. I can't wear my mask 100% of the time. Businesses that they want to pause. It's a pretty business friendly plan. I didn't lean on them to make it so, but I was, whatever you'd say, I was, pleasantly surprised when I saw it, because you can go eat under their plan that they're asking the governor to adopt. You can eat on the patio. You just can't, and you can do takeout, you can do delivery. You just don't eat inside the restaurant, which, makes a lot of medical sense. And frankly, at this point, makes a lot of common sense. So the governor, is slow to take all this in, study it, and poll it, and whatever he does with it. But I would guess that he will do these things, because the numbers will just keep getting worse until he does. And so he's shown a flexibility to change his position over the last few weeks. these asks are actually less, politically tough for him than the mask thing. So I would expect that he would do them.
And
But we'll
Judge,
see.
speaking of masks, how is Dallas County enforcing the face covering mandate from the state? Has there been any violations that have been issued? Those on the call have asked this.
Yeah, y'all are doing great, and it's a very light touch enforcement, right? We'd much rather, encourage people. These are not criminals if somebody forgets their mask going into the store. In order to get as far, I don't know that how many violations, if any, have been written by cities. The county has not written any yet. Really, people have to work their butt off to get one of these violations, because the way you'd have to do it is you get a free warning, right? So you'd either have to say to the officer, you know what, you can blah, 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 because I'm not doing that. Then you probably could, get yourself a ticket if that's what you want. But if someone just says to the officer, thank you very much, and doesn't see the officer again, then they're not going to get a ticket. And, we don't have some, sophisticated computer program. So if Beth got a warning in Irving and we see her without a mask in Grand Prairie, we know about it, do something. But what we're seeing is, by and large, everybody's wearing their mask, right, inside businesses. You go to the dog park or whatever, it can get confusing, because you don't have to wear your mask to go take a walk, but you do have to wear your mask when you're within 6 feet of people. So a lot of times when you go to outdoor activities, you'll find about half the people wearing their masks and half the people not wearing their masks, because of that bit of confusion. My suggestion to you and your employees is, when you go to walk your dog or whatever you're doing, just always have a mask, with you, right? Because you never know. You're at the dog park, you think you're going to be all by yourself, but there's a lot of people there, and people have their dogs playing right next to your dog, and they want to talk to you. So, have a mask. I usually carry a couple or 3 masks with me. So if someone forgets theirs, I had a man that forgot his yesterday, was able to, offer him a mask.
Thank you, Judge. And one last question. Any thoughts on school openings this fall? Obviously, with some of the news that broke yesterday, this is a hot topic of conversation. We would welcome the opportunity to hear from you.
Yeah, I want to commend Mike Morath and our school superintendents. We've been lobbying really hard for the last 2 weeks for most of the things, well, for all the things that there's some other stuff too, but for all the things that were announced yesterday. So what was announced yesterday is a break in the funding formula. School funding is very structured. And so we needed that flexibility that we had in the spring so that we could do some at-home learning too. And we needed money to get the plexiglass and the mask and be able to do a mask requirement for the kids. They originally said you can't do a mask requirement for the kids. You can't put face shields on anybody. Now they're saying we can. So all that is good. And 5 weeks is a heck of a long time, right? We just don't know what the world's going to look like in 5 weeks. And I know a lot of families have gone from, it's my own family. We've gone from, this is our daughter's freshman year. She's excited to go to her new school. We got to figure out a way for her to go, to, well, maybe we go 2 days a week, to there's no way in heck we're going to go into that school right now. And different people are at different places, and hopefully we'll all be at a better place in 5 weeks. But there will be opportunities for your child to get a good education at home, and there'll be an opportunity for your child to get a good education in school, and everybody's working really, really hard to keep your child and your family safe. Just, stay tuned and ask questions as parents. Ask questions. I get a lot of questions to me, and I know Dr. Hinojosa and the other superintendents get a lot of questions. Well, if my kid's at home, do I have the same teachers as if they're at school? My kid's in an accelerated program. what happens with this, that, and the other? Or my kid's special needs, and what happens with this, that, and the other? And so ask those questions. We're trying to figure it out and, build a plane basically while we're flying it.
And Judge, one last question for, those business leaders that have the responsibility of keeping employees employed is, as you look for, Alex Sakal had this question for the 5 biggest counties in Texas. What is the next step as he works to prepare?
Well, the next step is for the governor to do the letter that the doctors asked, which is the same letter in all 5 of those counties. And, then we've got to go to dallascountycovid.org for your business and your family. Download that color-coded chart. It's a little different in each of the 5 areas because the situation is a little different. But dallascountycovid.org has the one for the Metroplex. Follow it. If the chart says don't participate in X right now, don't participate in X. We've all got to move from the selfishness of our traditions and our desires and our things that we do to, a place where we are moving to sacrifice for ourselves, for our community, for our families. And so, that's where we are.
And Judge, thank you so much. I know we're just right over 10:30. I want to thank you for really just reminding everyone Irving does have a test site. So if you are having symptoms, that test site is at University of Dallas. Also want to encourage everyone, especially our social media users, stay connected with Judge Jenkins on Twitter through @JudgeClayJ. For real-time updates on what's taking place. And we look forward to having y'all back and others on Wednesday, July 22nd at 10 a.m. to continue to receive up-to-date information. Judge Jenkins, it has been a pleasure to serve on your task force representing our small and medium-sized business. And for those of you that are on the call that have suggestions, I just want to thank Judge Jenkins for really listening and being responsive to business industry recommendations, questions, and concerns. You and your team have done an incredible job. And this will conclude our Zoom today. Appreciate everybody's time.
Thank you all.